Hi there, I'm Dr. Marcia Nelson. This is video number 6 of the videos that cover child development, how to refer your child to find out if they might be eligible for special education. And this particular one is on social skills. I'm going to cover a lot of information in, I hope, 6 to 7 minutes. We're going to cover eating first. First, we just feed our children, either breastfeeding or bottles. Then they move into smoother foods. By 1 to 1.5, they're definitely scraping food toward them and picking it up, especially if those are smaller, soft pieces. They're able to start getting those in their mouth and feeding themselves. I know that then by the 2 years of age, most kids are playing with spoons in their bowls and trying to feed themselves. It's quite a humorous time where you might take pictures because they get very messy all around. By 3, a child is very competent with a spoon, and definitely by 4, both a fork and a spoon, and by 5, they know which utensil to choose for stabbing certain food and scooping other food. I can do more, but I won't today because we're going into bathing, bath time, and moving into showers and baths. I hope that early on you're just making a child very comfortable in warm water when they're doing their first bath. And then certainly by 2, they have that ability to hold themselves, but you're right there with them at the bathtub. Actually, I want to say I advocate always, until a child's about 6, staying with your child all the time if they're in a bathtub, because many an accident has occurred. I won't go that way. I know that a child is learning as you talk with them about it, the parts of their body, and bathing them. They are very capable by 3 to get their washcloth and float their toys and bathe themselves, not yet doing their hair, but they can be starting to do some of that at 4. And 5 and 6, you expect them to be pretty self-sufficient. The next area is getting dressed. At 1 to 1.5, a child is able to start putting their arms up when you say, hey, let's get our shirt on, putting their legs out if they are getting shorts on and you're helping. But as they mature and you want them more and more independent, then you urge them to start trying to get their head through the shirt hole for their neck area and get their own arms up and in a shirt or blouse and legs in. At 4, they're certainly able to hop up out of bed, get themselves dressed, sometimes holding onto their bed while they get one of their legs into the trousers or shorts, and getting their arms into their shirts and doing fine. Jackets, you want to remember that zipping is easiest first, snapping is next if they learn to get the 2 parts together, and buttons are last. Velcroing shoes is certainly easier than when they learn to tie, and many a child learns to tie by 4. It depends on how much instruction you're helping them with. I won't go farther than that with dressing. The next section is becoming a chore helper. A child at a 2-year age can know, oh, this is the napkin and that's the spoon, and I can take them over to the table and get them to each part where daddy or grandpa or grandma or mom is, and laying those down. That's a first chore. Some children at 4 are definitely getting up, feeding themselves, and getting their dog or kitty cat fed. So those are things that can be early chores. Chore helping is really fun for a child at first, so you want to encourage them to keep adding to that. Having a chore chart as they age into 5 and 6 so that they can check off that they're in charge of that and they've done it, and having sometimes some rewards at the end of the week if they've gotten everything done is helpful, but I don't say that you always have to reinforce. It's not necessary. They like helping, and you choose those things that might be helpful to you. It might be just folding up towels, sort of, and getting them onto the right shelf. And that can be done at 3 and at 4 and onward. The next thing is toileting. This is a very important area. And I recommend a program, a comic-like cartoon, that takes after the Mr. Rogers' Neighborhood. It's called Daniel Tiger's Neighborhood, and they do a very good portion. He's a little tiger, and he talks about getting up on the pot and taking care of your body's needs, and then wiping. I'll go into this. Certainly we help our children at first with lots of diapering, but they learn by 2 how their body is feeling, and they can tell you whatever your terms are, number 1, number 2, or yes, I have to pee, yes, I have to poo, whatever. You use those terms to start asking more by 2, such that they become able to be out of diapers, getting into pull-ups, sometimes sleeping through the night without being wet, and it's a very special thing. I honestly think graduated sizes of little potties are great, such that they move from a small one to a medium one to the regular pot, sometimes with an additional little part to the regular adult toilet, so that they don't feel vulnerable or falling through. But the children can learn that, oh yeah, I need to pee now, and then run there and don't ever be upset if they don't quite make it. Just urge them onward to keep trying to do that. You always want to have a routine of before bed, going to pee, getting on pajamas, getting to their bed, having a book. Or when you get up, you go to the toilet and sit for a few moments, because it helps them learn elimination. The part of toileting that's hardest is really wiping, and you just keep helping them learn how to get back and around and wiping their bums, so that they're very sufficient at that when they're going off to pre-K and kindergarten. And many a pre-K will not have a child if they are not toilet trained, so you want to emphasize that part. But let them be in charge of feeling their body. Oh yes, I have to pee. And when they do that, be continuing to say those words, pee or poo, whatever term you use. All right, the last thing is I want to say that children by 4 and 5 need to be learning their phone number of one of the parents, or grandpa, or grandma, or uncle, whoever's also in the home and they can reach. They need to learn their address. And the more you make that a routine and learning it and making it fun and saying, okay, we're going to pretend we're having a fire, and you know how to get to, when you're 5 at least, how to get to a phone, dial 9 and 1 and 1, and stay on the line, because they are going to ask you, where are you, if you say, there's a fire. So do teach those things. I hope you're remembering that routines are very important. Having regular chores, having a chore chart, having a child check off things that they're in charge of this, and they've done it on Monday, they've done it on Wednesday, they've done it on Friday. All those things are helpful. Having a little stool to get up to the toilet, or a stool to get up to start learning how to do their teeth. And they do progress from 2.5 to 3.5, knowing how to get it in there and brush basics. But as they're becoming 4 and 5, you want to make sure they learn the upper, the lower, both sides, all of that. There's a lot to these tapes. I need to end, excuse me. The next one will be on social skills and behavioral issues, and then we'll cover the 504 program in case a child doesn't qualify for special education. And then the last one is going to be on neonatal intensive care units, because I have a friend that can give some very good cues on what parents can do if their child, infant, is in a neonatal care facility. All right, thanks. I'm Dr. Marcia Nelson, and I'll give you my address next time again so that you can reach me if you have questions. Thanks.